Hi, my name's Phil. I like talking about politics, and in this video I'd like to take a look at the rising number of COVID cases in the UK, compare it to the equivalent time last year, discuss why it's happening based on expert commentary on the situation, and look ahead to September with no small amount of trepidation. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So I've been following the science and the politics of the pandemic quite closely, sometimes to the point where it's easy to forget that a lot of people won't understand enough about what's going on. The government have failed in their duty to keep the public informed. They say that it's our responsibility to manage risk. Oh, we've removed these measures now. It's now your responsibility, the public, to manage your risk, which is a daft idea at any time for health and safety issues. But they haven't provided us with the information needed to be able to form accurate risk assessments. The average member of the public, if you ask them what I would consider very basic questions about the virus or the vaccine, they'd be wrong. You know, I had someone ask me, for example, why the cases are continuing to rise, why they're so high now compared to last year. What is so different? I mean, there's a few things that are different, really. Although most of the country was out of lockdown last summer, just like it is this summer. In fact, last summer they were encouraging people to go into restaurants. It was a stunningly bad idea. But it wasn't all of the country. There were parts of the north of England that were still in regional restrictions. As far as they were concerned, they were still in lockdown. In addition, we'd mandated the wearing of face masks in indoor settings and on public transport. So you went into the shops, people had masks on. Public transport, people had masks on. This is no longer the case. But the biggest issue, if I was to say one single issue, is that the form of coronavirus dominant in the UK right now, the Delta variant, is twice as transmissible as the one we were coping with last August. And I've sort of said this before and sometime in the past, scientists are quite clear. More transmissible is actually more deadly than more deadly. You know, twice as transmissible is huge. It doesn't mean it infects double the amount of people. Like this time last year, we had about 1,000 new cases a day, and you'd think, oh, it'd be about 2,000. No, it's exponentially more. Because it's easy to understand when you consider powers of two. So someone infects another person now. They will, on average, infect twice as many other people as would have been the case last year. And of course, those newly infected people will have an average chance to infect people, and they will infect on average twice as many people as last year. But because there were already twice as many as infected people, that's actually 4 times as many people infected as last year. Then the next round of infections goes to 8 times as many, 16 times as many, 32 times as many, 64, 128, and so on and so on. It's a big reason why at the same point last August, we had about on average, 7-day moving average, 1,000 new cases per day and falling at that time. And why now we have 31,000 new cases per day and rising. And it's that rising that is a real concern as schools prepare to go back in England and Wales. They've just done so, I think, in Scotland, haven't they? But I mean, by the time they open up again in the rest of Britain, we'll likely see some impact on the Scottish infection rates. Professor Pagel, someone I've cited a few times on the channel, I'm going to link a blog that she's written down below, noted that schools returning doesn't automatically mean a surge in cases. There also has to be a high rate of infection in the community. Well, there is. On September the 1st last year, there were just over 1,000 new cases per day because it had come down a bit and then it had risen a bit. I don't know whether that was down to Scottish schools opening earlier or what, but for whatever reason, on the 1st of September last year, there were just over 1,000 new cases per day across the UK. 2 weeks later, it had more than doubled to 3,000. 2 weeks after that, it had more than doubled again to over 7,000 new cases per day. What's different this time? The vaccine? The vaccine protects us from becoming seriously ill. It doesn't stop us becoming infected, and it doesn't stop us passing that infection on. That's not a big difference. 2 out of 5 people in the UK have still not been fully vaccinated. Quite a lot of them haven't been vaccinated at all. But even those of us who have been fully vaccinated are not guaranteed to be fine. We're just more likely to be. Quite apart from the scourge of long COVID, which is a serious issue and is now affecting a distressing number of young people and kids, fully vaccinated people are still being hospitalised. It's just that in hospitals, it's now the majority of people in hospital are younger, unvaccinated people. But fully vaccinated people are still being hospitalised. Fully vaccinated people are still dying. We're up to nearly 100 COVID deaths per day again. Very nearly there. In fact, when you watch this, maybe we are there. Obviously, I do this a day in advance. What people need to understand is that just because the percentage chance of death is lower, thanks to the vaccination programme, so for an individual, your chance of death is lower. But if you infect a lot more people, then in that community, you can still get a death toll as high as we've seen before. It's quite simple. Let's say you slash the chance of death by 90%. But you increase the number of infected people by 10 times. Well, you're still going to get the same number of deaths. And each of those deaths is a person with friends and family. I regularly, and it upsets me, I regularly think about how some people are going to feel this Christmas, 2021. Last year, they got people round on Christmas Day because the government said they could. And a lot of people died as a result. People are going to have to live with looking at a chair where Uncle Dave sat last year and come to terms with the fact that because they couldn't manage to go just one Christmas without listening to his crap jokes, they'll never see him again. It's quite upsetting. Well, we're likely to do the same again this year. And even if it's fewer people who will be affected, it will be no less devastating for every family that does experience it. Everyone who has to sit around that table in future and go, was it me that killed them? Because someone did. Experts have said time and again, you cannot rely on the vaccine programme alone. It is a vital element, but you need mitigations as well. We are going to keep moving from wave to wave until we put things in place to reduce the spread of the virus. Schools are reopening. Kids are still unvaccinated. More than that, they are returning to those schools to be sat in close contact with lots of others for hours at a time, day after day, in often poorly ventilated classrooms without even wearing face masks. The government were told to mandate face masks in schools. They refused. They were told to bring in air purifiers at least as a cheap ventilation option. They are piloting a small study in Bradford, even though we know it works. They were told to vaccinate the over 12s. They say, well, we'll do the 16 and 17-year-olds. But they said that weeks ago. I was driving into Scunthorpe the other day, my nearest town, and the sign for the drop-in vaccination centre was still saying 18 plus. So even though they've made the decision to vaccinate college-age kids, they still haven't implemented it weeks later. So colleges, as well as schools, are going to be jammed with people, the vast majority of whom don't have even a single dose of the vaccine and without mitigations. If you want to read just how bad the situation in schools is going to be, I'll link that blog in the British Medical Journal below from Professor Pagel. But we saw what reopening schools did last year without enough mitigations, and we're in a much worse position now than we were then. We are also abandoning what piss poor mitigations we had. So it's like we're starting off in a worse position and we're having fewer mitigations in place. And you can't even talk about the vaccine when it comes to schools because they're not vaccinated. And the latest research in terms of vaccinations is suggesting that vaccinated individuals who become infected, and remember, there's nothing to stop you becoming infected with the vaccine, you're just less likely to become ill. So if you're a vaccinated individual and you become infected, your virus levels are just as high as those in the unvaccinated. We shift it more quickly. We get rid of it more quickly. The vaccine helps. It's not the vaccine's doing nothing. It is. So we are infectious for shorter periods of time than an unvaccinated person. But crucially, while we are infectious, we can absolutely become, infectious if we're in contact with another infectious person, just like anyone else. We are just as likely in that period of time to pass it on as an unvaccinated person. Like for like anyway. People with symptoms are more likely to pass it on because, the coughing and spluttering and all the rest of it. So you could argue from that point of view, a vaccinated person is less likely because they're less likely to have symptoms, which makes, and the symptoms make it easy for you to spread the virus. That being said, there's also an argument, and this is an argument, speculation, I haven't read research on this, but there's also an argument that a vaccinated person without symptoms is more likely to go out and about and without even observing mitigations like wearing a face mask. If they feel that the fact that they are vaccinated means that they're not infecting others as well, they may not wear a face mask because you don't legally have to. So maybe, and I don't know this, just speculation, but maybe we're actually more at risk of the vaccinated spreading the virus than the unvaccinated. There's so many factors to consider, but in terms of what we do know, it's that September is going to be a bad time. We are starting the month in a worse position and we have fewer things in place to guard against infection. And there's no link between cases and hospitalizations and deaths that has been broken either. The government tried to say that was a lie. It wasn't even just wrong, it was a lie. The researchers never suggested there's been a break in that link. The number of hospitalizations continues to go up, as do the number of deaths, and it's in proportion. It's a smaller proportion than before the vaccination programme, but it's still in proportion. This time last year, there were an average of 8 COVID deaths per day in the UK. Now it's 98. This is only going to get higher, much higher. The link is still there. If you double the rate of infection, you double the number of deaths. Last September, in that 1 month alone, we increased the number of new infections per day by 7 times. Even if you optimistically believe that that won't be as big a factor this September, it would still mean hundreds a day dying. We're going to get to the position where hundreds a day will die. And the government are doing nothing. I said at the start of our vaccination programme that I wonder how the public will react in autumn 2021 when they see that the vaccine alone doesn't work. With this pandemic, Johnson has managed to evade public outrage by, first of all, he promised mass infection would get it through. It'll just pass through us quickly and then it'll be done with. All these other countries messing about. No. Let just pass through, we're fine. That didn't happen, did it? Then he promised the lockdown would end it. We'll just have to lock down, that'll sort it out. Of course it didn't. Then he promised that test and trace would sort it out. It didn't. Then he promised that the vaccine programme would deal with it. No one thing deals with this. But I did wonder last year what the public would do when they could see that the vaccination programme isn't going to finish it. That we still have to keep going into lockdown, or if not lockdown, at least measures, or we have to put up with the bodies piling high. As we vaccinate more people, as the government boast about the percentage of people, the percentage of adults being vaccinated, they're going to find it tougher and tougher to explain away the increasing caseload. Well, if we've vaccinated so many people and you've said we only had to vaccinate like 80%, what? Why have we got increasing numbers of people dying? What are they going to promise us is going to deal with it when the vaccines aren't the magic bullet? Because if there's one thing we can do to start turning the tide against this pandemic in the UK, it will be to get the public to finally realise that the real emergency is Boris Johnson. The Conservatives in general, but there's not a lot we can do about that right now. But if the public turn against Johnson decisively, we can at least get rid of him. The next one may not be any kinder. In fact, I'm quite sure they won't be, but they might at least be more competent. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. And if you'd like to support the channel further, please click the Patreon link for details. And until next time, I'll see you later.